my favorite.
Thurea and Absalon Kent proudly show me pictures of their son Malcolm, a wrestler, lacrosse, and football player, and the boy who loved his church.
He volunteered at our church with youth programs. He liked to work with kids.
The Kents are a military family who had high hopes for their oldest son. That all changed last January.
He never saw his diploma. They came and presented it to us, but he didn't see that he did accomplish that.
At just 17, Malcolm died at home in Annandale after a 4-year battle with addiction. He had just visited the ER that day after a relapse.
When I went in to check on him the next morning, that's when we found that he had passed away during the night.
Malcolm died from fentanyl poisoning. His parents believe his social anxiety led him to self-medicate. They say he had been in recovery for using vaping and THC products, but his parents told the I-Team they never considered fentanyl until they read his autopsy.
Something that, no kidding, is basically the size of a Tic Tac and will take out your family.
Where do you think he was getting the pills from? Do you think he was getting it from other students?
We suspect it was other kids, but we don't know for sure.
Malcolm wasn't the only teen to die in Fairfax County last year. 4 others did, and there were almost 60 non-fatal overdoses, the highest number in 4 years.
You would hear every, month or two, there would be another one.
Marina Kura graduated from Wakefield High School in Arlington last year, where 2 freshmen died in 2023 of fentanyl poisoning, leading to community outrage and protests from parents wanting more done. Kura says she was so unnerved by what she overheard 2 students discussing in the bathroom after one of the deaths that she reported it.
They started saying stuff like, oh, he was one of my best buyers, and, he must have just taken the whole pill instead of half of it.
What does it feel like to be a student and hearing other students talking about dealing drugs that killed a student?
I think it was kind of a mixture of anger and disgust at the moment, because I was like, how are these people casually having a conversation about selling the drugs that killed a student?
We've seen many who have chosen to take a pill for the first time and not waken up.
In Loudoun County, Jennifer Evans is the director of Student Mental Health Services for public schools, teaching students and their parents how to spot signs of drug use and how to use naloxone.
They walk away with a kit to have on them in their home in case a kid, their own kid or someone else's child, is in their home and they see the signs of an overdose.
What do you say to the parents who say, that's not my kid, that's not my problem?
I would rather you come to have the information, so maybe it may not be your kid, but it might be one of your child's friends, and it takes a village to address this.
Next year, Evans is expected to lead Loudoun County's first planned school for students who want to continue their education while in recovery. Housed in a separate building, they're still waiting on funding.
It's not treatment, it's not an intensive outpatient program, but it would be a school environment with smaller teacher to student ratios.
What is it about what's happening that the feeling was we need something to help kids who are in recovery on their journey?
When you think about someone that's in recovery, one of the focuses is on eliminating the people, places, and things. So you could have lots of triggers that are in their homeschool environment.
I think it's complex because I can't control all the variables.
Fairfax County School Superintendent Michelle Reed met with the Kents and other families who have lost children to fentanyl, sharing some of their stories online, hoping to break through all the noise.
We don't pause sometimes and just take a moment and sit with the grief that surrounds this topic.
Reed says she's trying to direct families to available resources, and her school system is also focused on positive distractions like additional sports and events.
Because we know those are factors that will support healthy mental health and decrease substance use.
You're not going to be able to do this thing alone, so you got to let people know, hey, we need support.
It's so strong.
Stafford Nibley's mom, Liz, still loves to watch him sing.
Well, look how beautiful his eyes look. And look how happy. He was so happy.
At the time, a high school junior, Stafford was already addicted to drugs, starting with marijuana, then cocaine, heroin, and on and on. It was the start of a years-long battle against the illness. A few years after that musical performance that still makes her smile, Liz remembers dropping to her knees in prayer in Stafford's empty bedroom after he disappeared from yet another drug recovery program.
God, please, please keep Stafford alive. We love you, and give him another chance.
Liz didn't pray for a cure for her son or healing, not even a fresh start, just that her missing son was alive. Addiction rearranges an entire family's priorities.
It's very, very hard. There is no guidebook. And so at times you really feel like you're navigating this journey alone.
It shouldn't be this hard.
Dr. Mark Fishman is a Maryland psychiatrist specializing in addiction treatment. He didn't treat Stafford, but treats teens in what he knows is a tough environment to find care.
When I see parents, they are up to their ears in alligators. They are exhausted. That's the right word. They don't know which way to turn. They don't know what to do.
Fishman just opened Maryland's first inpatient drug treatment center for teens, the first one. There aren't many more in Northern Virginia and none in D.C.
Sometimes, as you say, people are lucky and get it first or second time, but a lot of people flounder and don't know and only get there after a near-fatal overdose, which is way too late.
In Stafford's case, it wasn't the first or second time at treatment.
Like 42.
You found 42 drug programs for your son.
All over the country. Yeah.
How do you do that?
I never gave up on him.
It cost hundreds of thousands of dollars even with insurance. His mom says some were better than others. Few had coordinated care at home. Not every family can do it.
We need to do a better job about pushing these treatments out into primary care because that's where kids already are.
Dr. Fishman means a pediatrician, but in most cases, it's not likely a child's pediatrician has experience treating drug use. There is a phone line to give pediatricians suggestions for treating teens, but no formal clinical guidelines to treat it from the American Academy of Pediatrics. Research published in the Journal of the American Medical Association in late February shows nearly a quarter of American pediatricians surveyed diagnosed an adolescent with opioid use disorder, but only 5.5% of them had prescribed the medicine that can save their lives by negating the effect of opioids. And in Virginia, it's against the law to prescribe them to anyone under 16. A law Dr. Zina Saliba believes hurts kids who need the medicine the most.
If there is a young person who's below that age for whom the standard of care or the recommendation would be, let's get you on a life-saving medication, that's not easy to do in this state.
Saliba is a psychiatrist and addiction medicine specialist at the Inova hospitals. She too hears from frustrated and overwhelmed parents and medical colleagues trying to convince them to make sure kids aren't going without treatment.
Kind of a dream state would be that no matter where you enter the healthcare sector, we will help you get to the right place.
And is that the case now for families looking for fentanyl treatment for their kids?
I don't think, not now. That's not where we are right now.
Saliba says not every adolescent needs an inpatient detox or treatment. Sometimes outpatient therapy and medication can be enough, but finding someone who can help direct that care is crucial.
One of the most important things is going to be meeting with a professional who is skilled in identifying the different domains, evaluating to be able to give you a strong recommendation.
In Stafford Nibley's case, Liz thought they had all that.
The poor guy didn't need to suffer. He just didn't need to suffer.
She kept looking for the right combination that would unlock her son's sobriety. But after 42 programs and almost 10 years of fighting, the addiction beat Stafford just days before his 25th birthday. Police found him dead in a Baltimore motel.
Police said there was so much fentanyl.
Leaving Liz his voice and her memories.
The many goodbyes that I said to him that I just hoped always for the future.
When I see her, I say, Ashley, please, mommy, wake up.
In 2022, Ashley died in her bedroom after accidentally overdosing on a drug that was laced with fentanyl. She was only 15 years old.
I don't see a future. You no longer have hope.
Esteban Cortez knows the constant fear of that potential fate. His daughter started using fentanyl when she was 14. Despite treatments, he says she's relapsed 3 times.
I heard many kids have died because of this drug. I was thinking that my daughter was also going to die.
According to a study published by the National Institutes of Health, overdose rates in the Hispanic community increased almost 290% from 2010 to 2021, with fentanyl being one of the main drugs to blame. A synthetic drug that killed almost 75,000 people in the U.S. last year, according to the CDC.
I will never forget my first time doing street outreach, and there was a group of maybe 12, 13-year-olds, and they were cooking up fentanyl.
Nora Morales is a program director for Identity, a nonprofit organization in Montgomery County offering free support to families with children addicted to fentanyl. She has seen firsthand the destruction this substance creates in some Hispanic families already facing challenges and trauma.
Those families have experienced a lot of loss, and when you add the immigration traumas, that is a recipe for a lot of isolation and depression, and so drugs seem very appealing.
In this 2023 report from Montgomery's Health and Human Services, 42% of ER visits for opioid overdoses in the county were Latino youth. University of Maryland professor Amy Lewin, who specializes in the study of family health, says many young people are pushed to drugs seeking some sort of relief from the trauma they left behind or the isolation they feel in a new country.
The journey overland that many of them went through to arrive in the U.S. was, in many, many of their cases, dangerous, threatening, full of deprivation and fear.
Lewin says even if the minors themselves didn't experience that hardship, what their parents went through can impact the children.
I still feel the weight of some of these things because their parents experienced it. So we talk about this as intergenerational transmission of trauma.
She says finding help when it comes to mental health or addiction can be a challenge for migrant families fearful of possible legal consequences.
This is a group that largely has less access to traditional mental health resources.
As we started looking deeper and asking more questions, we found there are even more victims. We're talking about the parents. They're undergoing an enormous amount of emotional distress, not to mention the financial impact they're undertaking while they're trying to rescue their kids.
I was alone with my son in the hospital. I didn't have anyone to help me with the company, so I went bankrupt.
Anna used to own a cleaning business, but when her 15-year-old son Steve started using fentanyl, she found herself juggling between getting him to treatment and just taking care of customers. It literally became a logistical nightmare for her. She eventually had to walk away from her business.
Well, for me, I had to stop working because of a crisis. In other words, it's difficult, because I couldn't work and financially contribute because I was taking care of my son. So you lose a lot.
We've actually even seen cases where the family has had to sell their home because of, their child's fentanyl use.
Jonathan Henriquez is with Identity in Montgomery County, which provides after-school resources focused on everything from mental health to substance use for underserved youth ages 7 to 25.
It's a huge financial burden. We provide, rental assistance. We can provide families with, food, clothing.
As parents find out, getting help for their children can be costly. According to the American Addiction Centers, outpatient drug detox programs range in price from $250 to $800 per day. Inpatient rehab programs are even more expensive, ranging in price from $5,000 to $80,000 a month. And then there's the medication. Costs vary depending on the drug, of course, but typically cost a few $1,000s a month. No matter where you live and no matter your financial situation, there are resources to help pay for your child's substance use treatment. Many programs take Medicaid, Children's Health Insurance Program, or CHIP, private insurance, and TRICARE. If you don't have insurance or treatment is still too expensive, there are ways to get help. Many programs will offer what's called a sliding fee scale, which allows you to pay based on your income. Ask about grants and scholarships or charity care, and if it will cover the entire time of your child's treatment, or if you have to pay the money back. Also, some facilities offer payment plans.